So today I will be performing a manual muscle test of horizontal abduction of the shoulder in gravity minimized position. I have my patient sitting upright with their arm at the level of their shoulder here on this table. I also have this under them so that it would be easier to slide their arm when I ask them to. So to perform this test, I begin by palpating their posterior deltoid. I would also stabilize their upper trap as I ask them to slide their elbow back towards me. So here I am palpating posterior delt. I'll stabilize up here the upper trap and the scapula, and then Kevin, I'm going to ask you to slide your elbow back towards me. And here I am feeling for the contraction of the muscle, which I feel. If I wanted to give him a grade of a 2+, I would apply some resistance. So Kevin, I would try to push forward with my hand, but don't let me move you, okay? So same idea. So push back, and then don't let me move you. Since he's able to resist, I can give him a grade of a 2+. This is a manual muscle test for horizontal shoulder abduction in the anti-gravity position. So I have my patient prone, and it's important that their head is facing the opposite shoulder of the one that we're testing. So I have his elbow here aligned with his shoulder, his arm at 90 degrees. I'm going to be palpating the posterior deltoid here. And as I come over to this side, I'm going to be stabilizing his ipsilateral, the border of the scapula. I'm going to be instructing him to lift the elbow to the ceiling as I palpate his posterior deltoid. So as I stabilize, palpate, Kevin's going to ask you to bring the elbow up for me. Beautiful, and I feel a contraction, so this would bring him to at least a 3. I'm going to be applying pressure at the distal humerus down, so Kevin, as I bring you to this mid-range, I'm going to be pushing down, don't let me move you, okay? So applying my pressure, mild, moderate, strong, and I would give him a 5 because he was able to resist. This is a manual muscle test for scapular adduction, so we'll be testing the middle trapezius. I have my patient laying prone with his elbow flexed at 90 degrees, but facing down, so I'm going to be on the opposite side because I'll be stabilizing his contralateral scapula while I'm asking him to raise the entire arm off of the table. And Kevin's, while I have you raise this elbow up, I'm going to be asking you to squeeze your scapula together here. So as he does this, I'll be palpating his middle trap. So go ahead, try lifting the whole arm. Very good. As I stabilize, so one more time down. And palpate again. Very well. So that would bring him to a grade of at least a 3. And then I will be applying resistance, pushing the scapula outward, so abducted. And Kevin's, you're going to be trying to make sure I don't move you, okay? So again, stabilizing, lift. I'll be applying my resistance out, mild, moderate, strong. And since he's able to hold against my resistance, he can relax. I will give him a grade of a 5. This is a manual muscle test for scapular adduction and depression. A crucial component of this test is that we set up the patient's arm in the right positioning. So Kevin, I'm going to ask you to make sure this elbow stays nice and straight, and you want your palm to stay mostly down, okay? So try not to flip the arm outwards. I'm going to be standing on the opposite side, stabilizing the opposite thorax. And I'm going to be palpating lower trap, so in between the spinous process of the thoracic and the medial border, right over here. I'm going to be instructing you to try to lift your hand up, but think of pushing into my hand at the same time. Very good. So that's your cue for when you lift, okay? So again, as I stabilize opposite thorax and palpate the lower trap, I'm going to ask you to lift up for me. Very nice, and down. And to apply resistance in this test, I will be applying pressure upwards and out. So again, Kevin, you're doing that same movement, and don't let me move you, okay? So again, mild, moderate, strong. Perfect, you can relax. I could give him a grade of a 5 because he was for scapular adduction and depression in a gravity minimized position. So the patient will still be prone, facing down. Similar testing positions to grades 3 to 5, except now we're going to be palpating the lower trap, just feeling for any contraction, although they're unable to clear the arm from the table. So Kevin's going to have you assume the same position, elbow straight, make sure that the arm doesn't flip forward, okay, like this. And then again, I'm going to be palpating the lower trap, stabilizing the contralateral scapula, and then feeling for any muscle contraction as he tries to go ahead and lift that arm off the table. And since I am able to feel some of the contraction, even though he's not able to lift his hand, I would give him a grade of a 2. I'll be performing a manual muscle test for our serratus anterior, so we'll be testing scapular abduction and upward rotation. So I have my patient sitting upright right now. I'm going to ask him to bring his arm into 120 degrees of flexion, so arm straight up, right around here. I'm going to be stabilizing his shoulder up here as I palpate, looking for serratus anterior in between the midline of the thorax and the lateral border of the scapula. And the cue that I'm going to give you when I tell you to move, you're going to imagine punching forward, okay? So only with your arm. So as I palpate right here and I stabilize his shoulder, go ahead and do that motion for me. Perfect. And since I'm feeling his contraction, I'm going to try applying some pressure. So as I apply pressure, I'm going to be holding his arm like this, trying to push his scapula inwards as I'm applying a downward pressure onto his shoulder. So don't let me move you, okay? I'm going to be trying to push you in and down. You want to push opposite of me. Ready? So as I apply my pressure, and mild, moderate, strong, he's able to resist my resistance. I will give him a grade 5. Muscle test for elbow extension. I'll be testing the strength of his triceps. For anti-gravity, we have our patient supine. I'm going to ask you, Kevin, to just bring your elbow to 90 degrees here. I'm going to be palpating the triceps as I'm also stabilizing his humerus. I'm going to ask you to just straighten out, okay? So straighten your elbow, bring the fingertips out, perfect. And I feel a contraction in his triceps. So to give him a higher grade now, I'm going to position you, Kevin, in like this halfway point. I'm going to be applying resistance straight down on the forearm here as I'm stabilizing his humerus. So I'll be applying a resistance downward, and don't let me move you, okay? So mild, moderate, strong, and he's able to fully resist against my force, so I will give him a grade of muscle test of elbow extension, testing the strength of the triceps. If the patient is unable to go through their full range of motion, we put them in gravity minimized position. So it's important to have something that's able to slide under their arm. At a table, I'll have their elbow at 90 degrees here, and they'll be holding on to the thing that they're sliding so they're able to move easier. I'm going to be stabilizing the shoulder here and asking Kevin's to essentially just straighten the elbow out on the table, out to your side. I'll be first palpating the triceps as I do this, so go ahead, Kevin, try to extend out. Very nice. And since since I feel the contraction here, he automatically gets a grade of a 2. The manual muscle test for wrist flexion in anti-gravity position. I have my patient here seated at a table with his arms straight out, relaxed in front of him. I'll be stabilizing the distal forearm as I ask the patient, while they keep all their fingers extended and straight, you're just going to be flexing your whole wrist straight up like this. I'll be palpating his flexor carpi radialis on the side of his thumb right here. So I'll go ahead and lift up for me. Perfect. And I feel the contraction of his muscle. So then in order to favor the resistance for flexor carpi radialis, I'm going to be applying resistance not only into extension, but also in the direction of flexor carpi ulnaris, so on the pinky side. So again, Kevin, as I stabilize here, I'm going to ask you to flex forward, and I'm going to be applying resistance down and to the side, so don't let me move you, okay? So as I begin my applying resistance, mild, moderate, strong, and I feel the contraction of flexor carpi radialis, and he resisted against my force, so I can give him a grade of about a 4+, since he broke a little bit at the end. This is the goniometry measurement for cervical side bending. I have my patient here sitting upright with the back unsupported, neutral spine. I have my gonio. I'll be placing the fulcrum at C7. So I'll ask Kevin to flex his head as much as he can to find C7, and I'll confirm by having him rotate and compare to T1, making sure that there's more rotation in C7 than T1. So Kev, just look to the right for me. Very good, and now to the left. Very good. Once I have confirmed that I'm on C7 and not T1, I will be placing the fulcrum of the goniometer on C7. The proximal arm is going to be perpendicular to the floor, and the moving arm is going to be following the direct center of his cranium. So I'll be palpating his C7, distal arm of the cranium, and then I'll be asking my patient when he's ready, Kevin, you're going to be trying to touch your right ear to your right shoulder. Good. And then here I can see that he is at 34 degrees of lateral side bending, with a firm end feel. Geometry measurement for the entire shoulder complex flexion. I have my patient supine with their arms straight out in front of them. To first find their active range of motion, I'm going to stabilize their thorax and ask our patient to bring their arm as much as they can straight above your head. Good. And then as far above as you can, stabilizing their thorax. Very good. So as far as you can go. Okay. And then so I would estimate range of motion, bring you back down. For goni measurements, I will be palpating the greater tubercle of the humerus, the lateral epicondyle, and then our stationary arm will just be the midline of the thorax. So again, Kevin, I'm going to ask you to bring your arm straight up. Very good. I'm estimating around 170 flexion, and then is that as far as you can go? Okay, I'm just going to ask you to hold it there. I'm aligning my gonio, so midline of the thorax, greater tubercle, and then lateral epicondyle. And I'm getting an active range of motion of 172 degrees. So now I'll have him relax his arm. I'm going to take him through his passive range of motion. So for this one, you're not using any muscles, okay? I'm going to be doing a vertical motion. So picking up his arm, again, stabilizing his thorax, and bringing him through the whole range, relax. Any pain? I'm going to apply a little bit of pressure down. Any pain there? And I'm assessing a firm end feel. So any pain? Okay, again, I'll leave him there and I'll re-measure. So greater tubercle, fulcrum, mid-thorax, lateral epicondyle. And I'm getting a passive range of motion of 175 degrees. To bring your arm down. Okay. For measuring goniometry of shoulder internal rotation, I have my patient supine, their elbow aligned with their shoulder at 90 degrees, and then I'm going to cue them to try to bring your arm down, palms facing down towards the floor, okay? As I tell him to do this, I'm going to be stabilizing here in his shoulder area, making sure that I don't feel an anterior shift of his humeral head as he's going down. So for active range of motion, I'll just ask him to do it himself, stabilizing the shoulder. So Kevin, go ahead and bring the arm down as much as you can. Good, and I'll just stop him if I start to feel any anterior shift of the humeral head. This is his active range of motion. For gonio landmarks, I'll be palpating the olecranon, the ulnar styloid process, and then our our stationary arm is going to be perpendicular to the floor. So here and then ulnar styloid. This is giving us an internal rotation of 45 degrees active range of motion. For measuring the passive range of motion goniometry for shoulder internal rotation, I'm now going to have my patient in the same position. So we're going to be relaxing the arm. I'm going to passively take him through his range. Again, stabilizing this humeral head, making sure there's no anterior strangulation. I'll take him through his end range, and it's a firm end feel. So from here, take the gonio, realign, fulcrum to the ulnar styloid. And now we get a passive range of 58 degrees. Fine gonio measurement for shoulder abduction. I will be placing my fulcrum at the anterior acromion with the stable arm parallel to the sternum, and the moving arm is actually going to be in between the two humeral epicondyles. So here I am palpating my anterior acromion while I place my fulcrum. I'm going to cue my patient to just raise their arm as much as they can out to the side. So Kevin's when you're ready, keeping the arm nice and straight, will follow out, making sure I'm keeping my moving arm in between the epicondyles. And with this, he has an active range of motion of 167. So then when I take him through his passive range, you can go, I'll stabilize his shoulder and make sure that you have any muscles. Okay, I'm going to take you through this motion. pain. And then I'm assessing his end field. He has a firm end field. So just keep the arm right here for me, kind of nice and relaxed. I'm going to remeasure. So fulcrum at the anterior acromion, parallel to the sternum, in between the epicondyles. Passive range of motion is 177. So for wrist extension goniometry measurement, I have my patient upright seated with their upper extremity supported. The fulcrum of our goniometer is going to be at the triquetrum bone. We're going to have our proximal stable, our stable arm is going to be aligned with the olecranon over here, triquetrum, and then we're going to have our moving arm aligned with the midline of the fifth metacarpal. So here I'll align the fulcrum with the triquetrum, making sure it's aligned with the olecranon. And then I'm going to cue my patient. You're just going to try to keep all your fingers straight and just lift your hand off of the table. Go ahead. So my patient has an active range of motion of 59 degrees extension. Okay, so for passive range of motion, I'm going to be stabilizing the distal forearm and putting their hand into extension ever so slightly. Should feel a firm end feel in pain. And then just relax the arm. Again, aligning the fulcrum with the triquetrum, proximal arm with the olecranon, moving arm at the fifth metacarpal. And I get a passive range of motion of 70 degrees of extension. First telemetatarsophalangeal extension, we have our patient laying supine. I'll put the proximal arm of my gonio just parallel to the foot. Our fulcrum is going to be right below the first metatarsophalangeal joint, and then our our distal or moving arm is going to be at the midline of the first metatarsal. So then I'm going to tell the patient to actively extend their toe, so try to bring the toe towards you. Good. He is getting 42 degrees of extension. And then passive range of motion. So he won't be doing any work himself. I'll just be passively bringing the toe into extension as I measure the same. Passively, I get a measurement of 55 degrees of extension.